I'm Elizabeth Turcott, Director of the Orthopedic Institute of Central Maine. The OICM is a dedicated surgical unit located here at Central Maine Medical Center. Today I'd like to talk to you about our innovative hip fracture program and the great results our patients are reporting from it. Just for a little background, around 350,000 hip fractures occur annually across the U.S. About 90% of those patients are over the age of 60. Historically speaking, patients that suffer a hip fracture never return to their baseline health or mobility, either with or without surgery. At the OICM, we're changing that.
There are two very important things that we've learned about hip fractures in our older patients. First of all, these are very serious injuries. Not only are we treating a hip fracture, but the fracture often brings to light other medical problems that a patient has. So it's very important that we aggressively treat all of their issues. Secondly, the timing of the care of these patients is very important. We want to get them to the OR as soon as it's safely possible, and then after that, we want them up and walking as soon as they can to limit any potential medical complications they could have after their surgery.
Care begins the moment people arrive in our emergency department. Hip fractures can be quite painful, so we really try to aggressively treat their pain and make them more comfortable, in addition to diagnosing their fracture. Oftentimes our patients have multiple other medical problems, so rapid diagnosis of those other problems and management of those can make a big impact on their overall outcome. Hip fractures are a major life change. It can have major impact on patients' long-term outcome. They can have loss of independence, sometimes can shorten people's lifespan as well. That's why we move hip fracture patients to a room in the OICM as quickly as we possibly can.
My job is to make sure that the focus is always on the patient. The hip fracture program takes advantage of our Core Connect care approach. We use a multidisciplinary team, which includes an orthopedic surgeon, a hospitalist, an orthopedic nurse, a physical therapist and occupational therapist, and a case manager, as well as many other team members to take care of our hip fracture patients. This assures continuity of care and peace of mind for the patient because they see the same caregivers throughout their stay. The patient and their family hear all the same information.
After surgery, we provide comforting care while the patient wakes from anesthesia. Then, typically a few hours later, when the patient is ready, we get them moving. We want to get our patients up and out of bed and moving as quickly as possible after surgery to avoid serious complications. So we get them to sit up, it opens their lungs and helps to oxygenate their blood, and we get them to stand and walk to avoid bed sores or blood clots. Our patients hear from us all the time. Exercise is medicine.
And it's true, the more a patient can move and walk, the faster they will recover. We give our patients and their families information about exercise programs they can do at home, and we give them information on safety tips and ways to hopefully avoid future falls. And certainly staying healthy and a healthy diet are important as well.
We're so happy to see hip fracture patients return to the independence and mobility that they enjoyed prior to sustaining their injury. We hear from many of them after being discharged from the OICM.
Here's the most important thing to remember. A patient with a hip fracture needs to be treated with urgency. Here at the OICM, we're prepared to give these patients the best treatment possible. The hip fracture program is designed to help them recover quickly and get back to their normal lives as soon as possible.